So let's take a moment to understand the content of those four bills. Now, Acts of Parliament, of course, we start by highlighting which ones they are. There is the Facilities Improvement Financing Act, which is expected to facilitate how facilities that are offering these health services will be retaining the resources they have. We'll get to the details. There's the Digital Health Act of 2023. This is one that is going to establish that we have digital registries where store information that can be shared across different health facilities across the country. There's the Primary Health Care Act. This is guiding how you'll be accessing primary health services at different facilities. And then there's Social Health Insurance Act of 2023 that establishes the various funds. It is also replacing the NHIF as soon as that becomes effective. Now, for the primary health care, the law is talking about the service in the community at levels 1, 2, and 3 of health facilities. We are talking about the dispensaries and some health centers. Basically, these are managed by the county government, and coming into law of this, then it means that you should be getting free services under the universal health coverage. Let's take a look at something else that concerns these new laws. Facilities Improvement Financing Act, which is going to ensure that public health facilities are able to retain the resources that they receive. So all the monies they raise, whether it is in terms of the charges, the fees, they should be in a position to keep that. So all incomes will also be supplementing the budgets that have been allocated by the county government. So in essence, this means that the counties will continue to allocate resources to the health facilities or dispensaries, but whatever levies or charges they collect. But also, if you look at the next slide, you'll see more resources that will be coming to them, especially on source revenue. That's just what I described, the charges and the fees. The insurance firms, because once you visit that facility, you may make a reimbursement or a payment through the insurance cover that you have. The funds will be used in service optimization at those facilities. And also something important is that the county governments will continue to make allocations, and they'll not be in a position to access these resources. So those resources, the user fees, the charges will be kept to maintain these health facilities, including donations and gifts may be also part of the sources of resources for those facilities. So the new health funds that are being created by these four bills, first is the Primary Health Care Fund, which is going to ensure that there is financing of primary health care services. The Social Health Insurance Fund, this is going to replace what you know, the National Health Insurance Fund, that is the NHIF. And there's a new fund, which is the Emergency, Chronic and Critical Illnesses Fund, that will be going to finance especially emergencies and the chronic illnesses that we may have, for instance, diabetes, hypertension, and cancer management. But there is a way that it's working that I'll be telling you shortly. So the Primary Health Care Fund will be used. Of course, it's created by the Social Health Insurance Act of 2023. It will be used to purchase the healthcare services. So remember, I told you that the health facilities will be retaining the reimbursement that comes to them. So this fund will be used to purchase that. So the sources of financing, apart from that, is the appropriations that will be made by the National Assembly, the grants and donations or gifts that may come to that facility, and of course the fees and levies that are charged by these facilities. And this will be followed by regulations that are to be designed by the Cabinet Secretary for Health Services in the country. Now, further, some of the sources of the Health Insurance Fund, which is again replacing the NHIF, there will be contributions by members of the fund or the households that are members of the fund, indigent and vulnerable persons in the country. These are people that cannot afford. There will be appropriations made by the National Assembly to go to financing their services, but also there could be gifts, grants, and financing mechanisms, especially innovative ones that may come as the law provides, as passed, assented to by the president. Now, the contributors to this SHIF, this is Social Health Insurance Fund, every Kenyan household will contribute. A non-Kenyan who is resident in Kenya for more than 12 months will also contribute. Employers, this is the government and private institutions, will also be making those payments, especially after deducting from salaried workers. More contributions, the contributors now, the monthly deductions on salaries or salaried or persons that have wages will be doing that. A percentage will be determined. Of course, there has been conversation about 2.75%, but apparently the regulations are yet to be put in place. The conversations are ongoing to see whether there will be a cap, but also ultimately what should be the percentage. The non-salaried persons, these are people that do not have a monthly salary, they will be making annual contributions, and these will be determined based on a weighted means testing mechanism that will be in a position to determine what is the worth of the income that a family receives every year. They make a contribution once every year. So needy households, this is the indigents, the Parliament and the County Assembly will be in a position to make allocations for that, but also the prisoners, people that are locked in jail serving sentences, it is the government that is going to provide for that through what is allocated. Now, there is a new fund, Emergency Chronic and Critical Illnesses Fund, that will step in as soon as you deplete your social health insurance fund. This is what will step in. For instance, if you have cancer or you have got into a position that is critical or it's an emergency, then this is what should step in there. But how do you finance this fund? Apparently, the law is saying that there will be appropriations made by the National Assembly. These are allocations made by Parliament, but also gifts, grants and donations may go to finance that particular fund. So essentially, the four bills are seeking to reorganize how services delivered, but also the financing of that, all the way from facilities to the storage of information and data which can be shared across different platforms in the country based on different registries. And